Good morning, everyone. I shall be presenting on yellow laser photocoagulation of deep conjunctival nevus, a minimally invasive alternative to surgical excision. So, as we all know, melanocytic tumors of the conjunctiva constitute 52% of ocular surface lesion, and conjunctival nevus is the most common benign periocular lesion. The diagnosis is essentially clinical, where conjunctival nevus is usually present since birth, is unilateral, variably pigmented, well defined in the interpalpebral location, limited to the limbus. Majority of them have cysts. There can be a change in size at puberty, and feeder vessels can be present, and they do not indicate malignancy always. So to confirm, we can further go ahead with an AIOS2025 where the lesion is seen as a subepithelial lesion with cysts. So ours was a prospective interventional case series where we included clinically diagnosed cases of conjunctival nevus which were stable over a period of 6 months. We performed laser photocoagulation with the help of yellow laser 577 nanometer. At follow-up of 1 day, 1 week, 3 months, 1 month, 3 months, and 6 months, we looked at the efficacy, the safety using ocular keratograph, where we looked into the ocular surface disease index, the tear meniscal height, the non-invasive tear breakup time, the lipid layer thickness, Schirmer's, Oxford corneal scoring. We also looked into the histopathology of the lasered conjunctiva. Results: the clinicopathology correlation of lasered conjunctiva, as there was no previous literature on yellow laser for conjunctival nevus. The first patient that we chose was this particular patient with a conjunctival nevus in an anophthalmic socket. Post laser, the visual changes, the first change we noted was this graying, then cavitation followed by blackening. Blackening we considered the end stage of laser. At this stage, it was removed with the help of a cotton bud. And this is at 1 week. You can see complete removal of the pigmentation. We also looked into the histopathology in this one particular case, where the gray part of the visual change corresponded to nucleus fragmentation in epithelium, and in the subepithelia 60% of the nevus cells were still viable, whereas in the blackening change the viable nevus cells came down to 40%. Moving on to the efficacy, we included moderate to severely pigmented conjunctival nevus, 10 eyes of 9 patients with a mean diameter of 4.2 millimeter, the mean age being 30 years, ranging from 6 to 63 years. I will like to draw your attention to the laser parameters. The power ranged from 300 to 600 milliwatt, the duration was 80 milliseconds, the spot size being 200 micrometer. Apart from one particular patient where there was mild conjunctival scarring, I will come to this patient, there was no other side effect seen in any of the patients. There was no recurrence seen at 10 months follow-up. Only in this one particular case, 2 sessions of laser were planned because the lesion was more than 10 millimeter in the greatest dimension. Apart from that, all the other 9 patients, 1 session sufficed to remove the nevus completely. So this particular case, I want to share the lesson learned. You can see in the inferior part, inadvertently the Tennant's capsule was removed, exposing the bare sclera, which resulted into this scarring and some tissue drag there. So the AIOS2025 again showing the removed Tennant there. So the lesson learned was, do not laser the Tennant's capsule. There was some transient congestion on first day post laser. However, there were no other changes in any of the ocular surface parameters over the period of follow-up. This is one patient showing over the period of follow-up. On day 1, you can see the epithelial defect there, which eventually healed up. A review of literature showed that there were the 4 existing studies who used argon green laser and frequency double ND YAG for such lesion, but all of them were superficial lesions, and all the patients we did were deep lesions. Thus, to conclude, this is the first study to explore the use of yellow laser for conjunctival nevus. This is the first study in Indians. The visual changes on application of laser are graying, cavitation, and blackening, blackening being the end point. On histopathology, the progressive visual changes correlate with decreasing tumor viability. Laser should precisely target the pigmented lesion in the conjunctiva while avoiding the underlying Tennant's capsule. It is a safe and effective outpatient procedure for the treatment of deep conjunctival nevus, offering excellent cosmetic outcomes with no significant side effect. Comparing with surgical excision, which has been the standard of care till date, this is a OPD-based simple procedure with quick recovery, cheaper, no need of any local or general anesthesia, no significant side effect. The only con being there's no histopathology confirmation. There, the clinical examination is of utmost importance before doing this procedure. Thank you everyone for a patient listening.
How does it act actually?
So the mechanism of action is the yellow laser energy is absorbed by two things. One is melanin present in the nevus cells, the melanocytes and the basal epithelium, and hemoglobin present in the blood vessels. So they absorb yellow laser energy, convert it into heat, and heat coagulates protein, and once it becomes coagulated, it can be removed with the bud. So that's the mechanism of action.
Can you do something like impression cytology to see that it is removed fully or not?
So
you said there is no conclusion that it is removed fully or not. Can you do something kind of?
So impression cytology helps us in finding out whether there is a dysplasia there or not. So here the removal is clinically evident, like you can see it is absolutely gone at the end of the procedure. So I don't think impression cytology will help.
But is there any chances of metastasis?
So these are all benign conjunctival nevus that we have included. We are not doing this for conjunctiva melanoma. So
That's why I'm asking. So how can you confirm? So
correct.
It's not it's a benign.
Yes, true. So that's why we have like the clinical clenches for conjunctival nevus, as I highlighted, and we have also included patients who were stable over a period of 6 months with no documented progression.
It's a good study.
Thank you. Thank you.